Good day, sir. I am Doria Tugaw from 3BS and D, and I am here to perform my return demonstration on Unang Yakap, or its essential intrapartum and newborn care. Unang Yakap was conceptualized in order to have early initiation of breastfeeding. It is a simple, cost-effective care interventions that can improve neonatal as well as maternal care. The purposes are: first, promotion of breastfeeding; second, emphasis on the need to breastfeed within the first 60 to 90 minutes; and last, to improve breastfeeding rates in the Philippines. The principles that need to be observed are the following. First, immediate and thorough drying of the baby; early skin-to-skin contact between the mother and the newborn; third, properly timed cord clamping; and last, non-separation of the mother and baby for early breastfeeding initiation. So now we will proceed to the procedures. First of all, let's assume that this white cloth is the patient's gown. Prior to woman's transfer to delivery room, ensures that the mother is in her position of choice while in labor. This is to promote relaxation and comfort. Ma'am, pwede niyo pong i-position ang sarili niyo sa position na komportable kayo. Second, ask mother if she wishes to eat, drink, or void. Ma'am, may gusto po ba kayong kainin or inumin? Gusto niyo po bang umihi? Okay. Next, communicates with the mother, inform her of the progress of labor. This is to give reassurance and encouragement. Ma'am, you are now fully dilated po. Prepare lang po tayo kasi ita-transfer po namin kayo sa ating delivery room. And then, woman already in the delivery room preparing for delivery. So the first thing, assuming nasa delivery room na tayo, and the first thing we're going to do is to check the temperature of the DR area. It should be 25 to 28 degrees Celsius. This is to eliminate air drop. So, assuming na check na natin ang temperature ng ating delivery room. Next, ask woman if she's comfortable with the semi-upright position, the default position of delivery table. Ma'am, okay lang po ba kayo sa semi-upright position natin? Okay, this proper positioning ensures better visualization. And then next, ensures woman privacy. So, i-close natin ang curtain, doors, and expose only the part that is needed to be exposed. And then next, remove all jewelry and wash hands observing the WHO 1, 2, 3, 4, 5 procedures to deter the spread of microorganisms. And then next, prepares a clear, clean newborn resuscitation area on a firm and flat surface. Check the equipment if it's clean, functional, and within reach. This is to save time and so we can work systematically. So this is my prepared newborn resuscitation area, and all the equipments are beside it and is clean, functional, and within reach. And then next, arrange materials or supplies in a linear sequence. So these are all the equipments and are already arranged in a linear sequence. And then next procedure, we will proceed to the cleansing of the perineum. Cleanse the perineum with antiseptic solution, which is betadine. So, this is to deter the spread of microorganisms. Assuming that these cotton balls are already soaked in betadine, and expose the part that needed to be exposed. And then next, rinse it with water. And then dry it with our tissue paper. And then discard. So, ibabalik ko lang ito kasi kakailanganin din natin mamaya. Okay, and then next procedure, wash hands and put 2 pairs of gloves aseptically if same worker handles perineum and cord. So, mag-wash hands ulit tayo. And then, maglalagay tayo ng gloves. And then, next procedure, at the time of delivery, encourage woman to push as desired. This is to provide support system. So ma'am, after ko magbilang ng 1 to 3, push po kayo ha. Okay. So 1, 2, 3, push. Okay. And then next, drape the clean and dry linen over the mother's abdomen and arms in preparation for drying the baby. And then next, apply perineal support and thus control delivery of the head. So, careful tayo sa pag-handle sa baby, especially sa ulo niya. And then, calls the time of birth and sex of the baby. Baby girl out 9:30 a.m. And then informs the mother of the outcome. Ma'am, lumabas na po si baby niyo po. And then, next, first 30 seconds, thoroughly dries the baby for at least 30 seconds from the face, head, from the trunk, going down to the trunk, and extremities. And have a quick check of the baby's breathing. This stimulates the baby's breathing and provides warmth to the newborn. And then next procedure, during the 1 to 3 minutes, remove the wet cloth and place baby in skin-to-skin contact on the mother's abdomen and chest. This facilitates bonding between the mother and the newborn baby. So remove natin ang wet cloth. And then place the baby in skin-to-skin contact with the mother. And then next procedure, covers the baby with dry cloth and baby's head with bonnet. This is to prevent the hypothermia. Okay, and then next procedure, place identification band on ankle of the baby. This is for proper identification of the newborn. And then excludes the during the 1 to 3 minutes also excludes the second baby by palpating the abdomen in preparation for giving oxytocin. This is to check for second baby or multiple birth. So palpate. So, walang second baby. And then next, wipe the soiled gloves with the wet cloth. And then dispose wet cloth properly. And then give iron oxytocin within 1 minute of baby's birth. This is to prevent bleeding of the mother and to deter the spread of the microorganisms by proper disposal of the wet cloth. And then, okay, so magbibigay tayo ng so this is our oxytocin 10 IU. May dry cotton balls tayo and cotton ball soaked in alcohol. Wipe the arms. Wipe the arms and then inject the oxytocin. And then wipe and then cover it with the dry cotton balls. Okay. And then, next procedure, remove the first set of gloves after positioning the baby for cord clamping. Decontaminate the gloves in 0.5 chlorine solution for at least 10 minutes. So, ipoposition muna natin si baby for cord clamping. Expose lang natin ang umbilical cord. And then remove the first set gloves. So this is our chlorine solution, 0.5 chlorine solution. Next po, place the umbilical cord to check for pulsation. So this is the umbilical cord. After pulsation stop, clamp the umbilical cord using the plastic clamp or cord die 2 cm from the base. So this is our plastic clamp. And then clamp it in the 2 cm away from the base. 2 cm from the base. And then next, place the instrument clamp 5 cm from the base and cut near plastic clamp, not midway. Okay, so this is our instrument clamp 5 cm from the base. And then cut near the plastic clamp. Okay? And then next, performs the remaining steps of active management of the third stage of labor. Waits for strong uterine contraction, then apply the controlled cord traction and counter traction on the uterus continuing until placenta was delivered. So, ganito yung pag-apply nun. Gagamitin natin ang ating instrument clamp and then sa paghila ng placenta and then after that, massage your uterus until it is firm. Okay. And then next, inspect the lower vagina and perineum for laceration and tears and repair laceration as necessary. Okay, so wala naman. And then next, examines the placenta for completeness and abnormalities. So ang ating placenta ay complete naman at wala namang abnormalities. And then, iset aside lang natin. And then, cleanse the mother, does perineal flushing, and applies perineal pad or napkin as needed. So, gagamitin ulit natin ang cotton ball soaked in betadine solution. Betadine. Okay, so, from mons pubis, labia majora, labia minora, sa kabilang side, labia majora, labia minora, sa gitna hanggang anus, left groin, right groin, and then discard. And then rinse it with water, and then dry it with tissue paper. And then discard. And apply napkin if necessary. And then next, check baby's color and breathing after scoring. Check the mother is comfortable and that uterus is contracted. Okay, so activity, grimace, appearance, respiration, Apgar score 8. The mother is comfortable, the uterus is contracted. Next, dispose the placenta in a leak-proof container or plastic bag. So, lalagay ito ang ating plastic bag. So, before natin ito i-dispose, tatanungin muna natin ang ating patient kung gusto ba nila itong iuwi or hindi. And then, tatasahin natin. And then, after that, decontaminates decontaminates the second gloves before disposal and stating that decontamination lasts for 10 minutes. Next procedure, advise mother to maintain skin-to-skin contact. Baby should be prone on mother's chest and up in between her breasts and with head turned on one side. Ma'am, maintain nyo lang po ang skin-to-skin contact sa inyong baby, ha? Ayan. And then, by 15 to 90 minutes, advise mother to observe for feeding cues and cite examples of feeding cues. Ma'am, obserbahan niyo lang po ang anak niyo if gusto niya po bang mag-breastfeed. Ilan lang sa mga sample ng feeding cues natin is pag mag-open siya ng mouth, or ilalabas niya ang kanyang dila, or mag-ilig, or ikaproll niya ang kanyang kamay sa inyong nipple. And then next, supports mother, instruct her on positioning and attachment. Ma'am, ganito po ang tamang position, ha? Okay. And then next, waits for full breastfeed to be completed. Next, after a complete breastfeed, administers the eye ointment. Eye care is given to protect the baby's eye from eye infection. So, i-remove muna natin si baby sa kanyang mother. Lalagay muna natin siya sa resuscitation area. But for better visualization, dito ko lang muna ilalagay. So, eye ointment from inner canthus to outer canthus. And then next, proceed to the physical examinations of vital signs. And then get the anthropometric measurement of the baby head. And then chest. And then abdominal. And then length. And then after that, weigh the baby. So assuming that this is a weighing scale. And then after that, record. And then next, give the vitamin K. This is to protect the baby from the bleeding that is caused by the lack of this essential vitamin. So this is our vitamin K. We have here dry cotton balls soaked in alcohol and dry cotton balls. Then discard. So inject it IM 90 degree in vastus lateralis. Dry cotton ball. Plaster. And then next, inject the anti-hepatitis B vaccines. So this is our anti-hepatitis. This is to protect the baby from the hepatitis B infection. And then next, inject the BCG. This is to protect the baby from serious forms of tuberculosis. This is our BCG. Inject it intradermally. Next procedure, advise optional or delayed bathing of the baby. Ma'am, i-delay nyo lang po ang pagpaligo kay baby ha. Kasi ang early bathing of the baby po, nire-remove niya po ang vernix na nagsisilbing protective barrier po ng ating baby. And it also hinders the crawling reflex and leads to hyperthermia. And then next, advise breastfeeding per demand. Ma'am, pag mapansin po ninyo yung mga feeding cues po, tulad ng mga nabanggit ko, ipa-breastfeed nyo po ang inyong baby po. Let the baby feed for as long as she wants on both breasts. And then, in the first hour, check the baby's breathing and color, and check the mother's vital signs, and massage uterus every 15 minutes. Okay, so, si baby, okay naman siya. I-move muna natin siya para makafocus tayo kay mother. And then, si mother, check natin ang vital signs. Okay, and then massage the uterus every 15 minutes. And then in the second hour, check the mother and the baby for every check the mother and the baby every 30 minutes to 1 hour. This is to prevent the accidents such as falls and accidental suffocation from occurring. And then last procedure, complete all records. And then